long term, there may be opportunities for us to look at how children's A&E sits within the adults A&E and make some efficiencies, but it's too early to call that at this stage. And we've clearly broken down the current 4.2 million spend in the community and how that would, the two options be divvied up. High level investment in further diagnostics in the urgent treatment centre and then a consistent offer for the 4 hubs that addresses the variation in consistency. Until we've concluded consultation, we cannot get into a further level of detail inappropriate. There's been a commitment made several times tonight. We will work with providers and stakeholders to shape it from the 12th of December onwards until final recommendation to governing body. The additional appointments, the 1.8 million gives an extra 1,440 a week. That's a lot of extra appointments, nurse and GP. And finally, just on the workforce, because I know that was a question, just to reassure people, there is a workforce strategy group. We recognise the workforce is very challenging for Wirral as well as everywhere else nationally. And we're working very hard to actually work with providers to actually look at how we can recruit and retain the right levels of staffing, how we can train people up. We believe that this offer, working with providers constructively, starts to actually consolidate the workforce and actually is more supportive going forward and more sustainable. But that is not to say it's without its challenge. We're going to be having open conversation with key stakeholders about how we move forward with the workforce issue.
Thank you, Jackie. So thank you to colleagues who've come this evening and presented witness statements from across the provider sector, and thanks to the members of the public who've stayed tonight for a very important debate. And thank you particularly to the Wirral Council for inviting health and care commissioners and indeed providers to explore this. It's an important issue within our Healthy Wirral programme to tackle urgent care. What we're hearing as part of the consultation will help us make some important and difficult decisions in the new year, and it's important to stress again that during the consultation period we are here to actually listen and take on board ideas, new ways of doing things, and if there is alternative solutions we absolutely will take them into account. The transformation of urgent care is an agreed and a key priority amongst health and rural partners, and that includes all current providers of these services and those of you who have heard from the Seacombe as well as the commissioners. And we cannot stay as we are as health and care. We need to change, and much of our proposal, as you've identified, is driven by national requirements in relation to improving urgent care across the patch. Councillor Norbury identified that actually our health and care services have grown over time and there has been a lack of strategic planning of where they're delivered. Councillor Norbury has also identified quite correctly there is an allocation by government which is voted for by Parliament, which is fixed every year. This is about living within our means, but improving the services whilst we do so. On top of that, we have an additional £1.8 million in funding for additional GP services. We're not closing services, we're redesigning how they're delivered to ensure they're more sustainable and deliver better outcomes for local people. So the extra investment in GP extended access is welcomed. It's been welcomed by GP federations, have been recipients of that funding in terms of providing the services, and it's right and proper. It's an aligned requirement. We recognise the GP colleagues' concerns in both the two federations, although I think I am somewhat confused, as has been highlighted by one of the councillors, that we've had different and polarised views from the federations, and actually I've heard a different approach from one of the federations this morning on the radio to what I've heard tonight. But what we need to do is get in the room and thrash this out. Because actually we have been working closely with those two federations, with our partners in Hospital Trust, Wirral Community Trust, and who aren't here representing our Cheshire Rural Partnerships. Because mental health, good urgent access to mental health services is also part of this offer. And I think we've probably missed a trick in not inviting Cheshire Rural Partnerships.
We did actually, Simon.
Oh, we have, and they declined, unfortunately. Thank you, Councillor McManus. So, this investment could double the number of additional primary care appointments per week to 1,440. And primary care, we know, is the main route through which people access urgent care. So, we need to make the health and care system work better for people world, and too often we have had an inefficiency and duplication. And we really want to work with all partners together and consider the needs of patients and the public as this consultation evolves. There are elements that are undefined, and there are elements because we are still undertaking that consultation. And there are elements actually are still unsure and unclear to you because they're about other adjunct services. They're about the development of the neighbourhoods, development of frailty services in those neighbourhoods, because many of the people who picked up in urgent care as older people has been failures in planned care and failures in managing long-term conditions. And those frailty services we're currently developing on that neighbourhood basis seek to address that. I think I'll conclude now as time is pressing, and I'm sure councillors wish to ask any final questions of us. But thank you very much again for inviting us. We welcome the opportunity, and we look forward to seeing other people at the future public consultation around this, which will now run through to the 12th of December. Thank you.
Thank you, Simon. There are a few more questions that I know we've got, but I equally would like to thank everybody for attending, that's both presenters, councillors and the public, although I know some people have had to go. I believe that tonight has been a good meeting. It's allowed for constructive but very robust consultation, even though on occasions it has been quite an emotional issue that we're talking about. Now, we've got, I think, Sharon, you wanted to talk earlier on, so if that's still relevant, we've got Sharon, we've got Tony Cottier, Tony Norbury, and then Samantha, and Tom Usher. Thank you.
Jackie, sorry, you just replied to some of my question. And you talked about recruitment and retention of the workforce, but what impact assessments and horizon scanning have the CCG actually done to look to see whether the provision of services is going to be sustainable?
Okay, thanks for the question. So when we put forward the options and proposals, and what we've done the modelling based on activity and assumptions about what was to be provided and the cost of that, we believe it can be provided partly within existing deployment of staff by consolidating the services into 4 consistent offers in the community, because we've got, as you're aware, 3 walk-in centres and 3 minor injury units offering different hours and different things, and to consolidate that. So it may mean that staff may have to be asked to work in a different location potentially, maybe some different hours, but we think that the much of the resource currently available can be part of the ongoing offer. Clearly with the enhanced primary care 1.8 million, that's part of that will be additional recruitment. And we've already said that there's conversations ongoing with the Federation, 720 additional appointments have already been provided to provide the additional amount that we need to get in place by April. Those conversations are underway with the future signing of contract agreements end of December, early January. There has been no risk flagged to date to the CCG from those federations about the ability to recruit GPs or nurses. That said, we have got a clinical modelling group which we're running in parallel to the consultation, then we'll carry on beyond, where we have all key stakers involved, and the workforce is clearly, as you'd expect, a very focus of discussion as we take it forward and make sure that we have all the bases covered.
Councillor Cottier.
Thank you, Chair. Thank you very much. And as you alluded to, the discussion has been very robust. I attended one of your presentations in Heswell on Thursday. After tonight and hearing the juxtapositions that we've all heard, will you be representing them, their opinions and their points of view? Will you be representing them at the further meetings? So people who attend their meetings and haven't been privy to what we discussed tonight will have a clear view on both sides rather than just your own side. And Jackie, when you say we, are you representing the CCG here?
So yes, I am a member of the Integrated Rural Health and Care Commissioning Unit, so I have a combined integrated post. So for this purpose, I am representing the CCG with the lead on home care. So, okay. So we've got a duty to ensure that we're sharing all the similar, consistent information with all the public meetings, and we will continue to do that because part of that is clearly articulated to the public what the offer is, because we recognise there's been a lot of confusion, a lot of myths flying around. So some of what we will present will have to be consistent because we need to do that. That said, we absolutely want to take away from every single one of those meetings the views of all stakeholders and all members of the public. So we've been recording those, you know this, we've been responding to the questions and writing those comments up on the chart. So there's a balance between making sure we're consistent with people and they get the same explanation, but then we'll take all views away for due consideration and taking that in.
Sorry, just to answer that then, so you're giving your point of view, your standpoint, without giving a chance for the people who are attending the meetings not to hear Dr. Montgomery's point of view, who does represent Mountain GPs on the Wirral. Would it not be more prudent to have the Federation there to represent their views? Would you do the right thing, consider inviting them along for future meetings?
Yeah, so Dr. Montgomery has had some of the public meetings, but we also, as Paul alluded to earlier, we've also had to date one dedicated GP session, and we've got a further two arranged in November. So all GPs are able to come, and actually we can get under some of the teeth of some of this, because with respect, you know, when we consider the public meetings and how they go, there's a lot we need to get into in terms of levels of detail for the public to really understand the proposals on the table and for us to duly answer their specific questions as well. So we need to make sure it's fair and balanced for all members of the public as well, not just as GPs. So there's a range of arenas that we're trying to provide that people can choose which ones to go and attend. We'll duly consider everything that's fed back in those meetings.
Thank you. We're going to take Councillor Norbury and Councillor Usher.
Can I make any questions? I've been referred to in certain things.
No,
Because
I think that we need to.
I need to have another response because
Dr. Montgomery, I'm really sorry, but we do need to move on. Thank you.
Okay.
Okay, so I've got Councillor Norbury, Councillor Usher, Gilchrist, and then I'll close with Councillor Frost. Please, thank you.
Julie, I'm willing to give way for Dr. Montgomery if he wants to speak.
Okay. Dr. Montgomery, can I ask you to keep it really brief? Thank you.
It will be Chair. Councillor Norbury, thank you very much for giving the option to speak. First of all,